4-pattern approach. First, you should look for nuclear features, then architectural features, low-grade growth pattern, mitosis, and necrosis. This is how you are approaching any slide given to you, thyroid slide. So what are the nuclear features is, remember, if the normal thyroid follicles will be lined by these cuboidal cells, right? Here will be a choroid, correct? So if this cell acquires a mutation of BRAF, some BRAF mutation has occurred. This will go into the pathway of your papillary carcinoma of thyroid. If this cell has acquired the mutation in RAS pathway, then it gives rise to your follicular type of thyroid neoplasms. Okay. So now this has acquired the mutation, correct? So it wants to divide, right? The cell wants to divide. So imagine this is your follicle, this cell got mutated. So it wants to divide, so that's why it will project into the lumen and giving rise to formation of the papillae. You understood? Correct? So cells are dividing rapidly and it will divide inside the lumen because basement membrane is here. Here growing is less resistant than growing this side, no? Correct? So they form this papillae. So they'll have this blood supply. This is called as papillae. The definition of papillae is they are finger-like projection with fibrovascular core and lined by this epithelial cells, right? Now, at this tip, there will be less blood supply. So the cell will die. So when cell will die, there will be deposition of calcium. Concentric deposition of calcium leading to formation of somama bodies, correct? So any papillary type of tumor you see, you will tend to see this somamatous type of calcification. Where you have meningioma, it grows in whorls. No, the center part of this meningeal cells will not get a blood supply. So there will be calcification. That is called somamatous calcification you see in meningioma. Even you have a serous carcinoma of ovary where the tumor cells will go like papillae. So at the tip, you tend to see the somama type of calcification. Even in papillary carcinoma of thyroid, you see this somamatous calcification. So it's the same concept for all the papillary type of tumors. Okay. Now coming to nuclear features. So now this cell wants to divide, correct? So if any cell wants to divide, it has to increase the DNA content. No. So what happens? The nuclear membrane has to become loose or stiff because I want to divide. No, DNA has to divide. So your nuclear membrane has to become relaxed. Then only the content can divide. No, if I am tight, I cannot divide. So when your nuclear membrane will lose because the DNA is getting duplicated, so it is lax, right? Now you have a cytoplasm. So what happens? The cytoplasm will come and invaginate into the nuclear membrane. So then your nuclear membrane will form this like of inclusions. So that is not a true inclusion. That's why we call it a pseudo inclusion in case of thyroid, because the nuclear membrane is become lax. Why? Because it has to divide the DNA content and it has to divide. So the cytoplasm has entered inside, no? So that gives an appearance like your inclusion. That is why it is called as pseudo inclusion. What is true inclusion? Like something getting accumulated in the nucleus, which is not your DNA or which is not the normal protein content or the DNA content which are supposed to be in your nucleus. So like for example, if you have a viral infection, that time virus cannot divide. It does not have the DNA mechanism. So it will come and bind to host DNA, that is your DNA, and it starts replicating. So the virons will get produced and they get accumulated in the nucleus. That is called as intranuclear inclusion. Those are true inclusions. But in thyroid, because the nuclear membrane is lax, the cytoplasm will come and invaginate, that leading to the formation of pseudo inclusions. So that's why when you observe these inclusions, this nuclear margin will be thickened here. And the color of this inclusion will match with this color of the cytoplasm. Okay. So this is the next characteristic feature of your thyroid carcinoma, papillary thyroid carcinoma. One is you should know the definition of true papillae. Next is inclusions. Next, now I told no, this nuclear membrane is lax. So it can get folded and give rise to this longitudinal grooves. That is third characteristic feature. Fourth is because of the processing artifact, the thyroid, papillary carcinoma of thyroid, the nuclear will have this optically clear appearance that is called as orphan nanny nuclear. Okay. So these are the features of your papillary carcinoma thyroid, nuclear features.